Diagnosed 2019. I'm Dheeraj Anirudh and I'll be one of your quizmasters for today. So let me first thank our sponsors. Our title sponsor Neo MBBS, our knowledge sponsor Bharat Biotech, and our steady partners Prepladder and Educon India. Dare to Diagnose is an opportunity for all of you to showcase your clinical acumen and your sleuthing skills. So we have fantastic prizes for you guys, including a total prize money worth of over 3 lakh rupees and cash prize of 36,000 rupees. That should get your adrenaline rush going. I request the participants in the balcony to come to the front so that they can see all the questions properly. Now let's get to the rules of the team. Teams of 2 or 3 are allowed. All undergraduates and interns are allowed. Cross-college teams are allowed. And in case anyone of you still doesn't have a partner, please come to the front and we'll pair you up. Did all of you get your prelim sheets? Or is there anyone without a prelim sheet here? Please raise your hands if you don't have a prelim sheet here. Okay, let's get to the event structure. We'll have a pre-length session and a post-length session. During the pre-length, we'll have prelims which have 25 questions. And in the post-length, we'll have the top 16 of prelims advancing to the pre-finals. The pre-finals consist of 3 rounds. The first one being the tops, second one being the pictionary, third one being the grid. So after that, 3 teams will be eliminated. The top 3 teams will advance to the finals. In the finals, we'll have a case scenario which will be judged by our judges. And then we'll have the final rapid fire and our winners will be crowned. So without any further delays, I'd like to pass on the mic to our prelims host, Anugya and Kirtana.
Let's give them a round of applause, guys. Hello. Are everyone able to hear me? People at the back also. So, good morning everyone. Welcome to Dare to Diagnose 2019. A very warm welcome to all of you. So, without any further introductory speeches, we'll first go on with the prelims. This is Kirtana and there's my other co-host Anu here. So we'll be your hosts for the preliminary round. So we'll start first with the rules of the prelims. So teams of 2 or 3 are allowed, cross-college teams are allowed, as Dheeraj said. There will be a total of 25 questions for you people, among which 5 will be star questions. Every 5th question will be a star question, for which you will be given 3 points for the correct answer and -1 for the wrong answer. So there is negative marking for star questions. The other 20 questions will grant you 2 points for the correct answer and there is no negative marking. So here, please kindly switch off your electronics or cell phones and put it in your bag. Any person found with cell phones will be disqualified automatically. Our volunteers are watching you. And please write your answers legibly over the answer sheet. And still again, on your answer sheet, write your teammate names, everyone's, and write at least 1 contact number. Write your team name, write all the members' names, and a contact number. So everyone has received the answer sheets, right? Still anyone without a partner? So everyone at the last are able to hear me? Voice is good? Like volume? Okay. So are you ready, guys? No excitement at all? Okay. So as a wise man one time said that diagnosis is not the end, but just the beginning of your practice. Let us start with our first question. A 20-year-old male came with vomiting, abdominal pain and shortness of breath. His random blood sugar level is 340 milligrams per deciliter. He has delayed skin pinch and his breath has a fruity odor. On examination, you find tachycardia, hypotension, and abnormal breathing pattern as shown below. Which type of breathing pattern does it represent? Starting with our basics. Which type of breathing pattern does it represent? Please write your answers legibly. Now let us go to our second question. A 17-year-old girl comes to a gynecologist because she didn't attain her menarche yet. Examination showed normal breast development. Pubic hair is coarse and extend to the inner surface of her thighs. USG shows normal ovaries but no uterus. Which of the following is the cause of her condition? Option A, sex chromosome monosomy. Option B, failure of Mullerian duct recanalization. Option C, Mullerian duct agenesis. And option D, aromatase enzyme deficiency. Now let us move to our third question. A 3-month-old child presented with excessive irritability, abnormal posturing since birth, and delayed developmental milestones. There is a history of sibling death at day 15 of life. On laboratory testing, urine exhibited a characteristic odor and was positive for Rotaras test even after boiling and cooling. What is the basic biochemical defect here? Option A, deficient decarboxylation of branched chain keto acids. Option B, GLUT4 transporter dysfunction. Option C, defective insulin secretion. And option D, severe starvation. Rotaras test is given for you by the side. Please write along with the option complete answer so that it is easy for us to evaluate. So let us move to our next question, fourth question of today. A 2-year-old child was brought to outpatient department with chief complaints of abdominal pain, vomiting, and passage of blood and mucus in the stools. Ultrasonography of abdomen showed pseudokidney sign and barium enema showed the following findings as shown in the image below. What's your diagnosis? Option A, pyloric stenosis. Option B, intussusception. Option C, Hirschsprung's disease. And option D, volvulus. I guess you don't need a clue on this, guys. Now moving to our next question, which is the first star question of today. A 60-year-old man came with chief complaints of low-grade fever and pain in the knee and wrist joint regions. He had 4 to 5 such attacks in the last 5 years. Imaging reveals linear radiodense deposition within the articular cartilage. Synovial fluid examination has shown the presence of rhomboid crystals which are weakly positively birefringent. What is your most probable diagnosis? Option A, calcium pyrophosphate deposition disease. Option B, gout. Option C, calcium apatite deposition disease. And option D, osteoarthritis. This is a star question, guys. You will be awarded 3 points for correct and -1 for the negative answer. Ma'am, please put down your phone. Now let us move to our next question. Sixth question. A 15-year-old child came with unilateral hearing loss in the right ear and unusual loudness of his own voice. He also complains of nausea, vomiting, and giddiness on hearing loud sounds. pure tone audiometry has shown the following findings. Stapedial reflex was normal. The child is most likely suffering from option A, Meniere's disease, option B, superior semicircular canal dehiscence, option C, cholesteatoma of the middle ear, and option D, otosclerosis. I guess everyone are able to see the graph and the numbers, right, from the last? Vertically, and x-axis and y-axis. It is only 1 minute for every question, so that's it. In the x-axis is the frequency and in the y-axis is the intensity. Now let us move to our next question, seventh question. A female presents with galactorrhea, amenorrhea and infertility. MRI showed a homogeneously enhancing mass in sella turcica region. The specimen obtained at transpenoidal surgery was sent for histopathological examination, which has shown the presence of acidophilic cells with pleomorphism and atypical mitosis. PET or CT scan has shown no metastasis. What's your diagnosis? Option A, craniopharyngioma. Option B, pituitary carcinoma. Option C, meningioma. And option D, pituitary adenoma. Observe everywhere. Observe everywhere if you are using the phones. Now let us move to our next question. Eighth question. A 45-year-old female presented with chest pain radiating to both her arms and is increased on coughing, sneezing and twisting movements of her chest. On examination, there was swelling and tenderness over costochondral joint. ECG and chest X-ray were normal. What is the cause of her chest pain? Option A, myocardial ischemia. Option B, Mondo's disease. Option C, Teat syndrome. And option D, cervical radiculitis. People are telling to increase the time, everyone, between each question. Okay? 15 or 10. Yeah. Thank you. Do you want more time or my speed was? Now let us move to our next question, ninth question. A primigravida in her third trimester with the size of her uterus corresponding to her gestational age comes to the antenatal OP with complaining of sudden onset, painless vaginal bleeding which is of bright red color. On examination, there is slowing of fetal heart rate on pressing the fetal head down into the pelvis which recovers promptly as the pressure is released. It is suggestive of which type of placenta? How many seconds are we? So now let us move to our next question, guys. The second star question, 10th question of today. A 53-year-old male with a documented history of diabetes, hypertension, and factor V laden presented to the emergency room with progressively increasing headache, slurred speech, and left upper extremity weakness. There is a 3-month history of warfarin use for DVT prophylaxis. After presentation, the patient suffered a brief coma followed by quadriplegia and anarthria. Vertical eye movements, blinking, and pupillary reflexes were intact. An MRI would show damage to which of the following structure? Option A, thalamus. Option B, midbrain. Option C, pons. And option D, upper medulla. This is the second star question. If you want, I can give a small clue for this. All the followers of House MD would have already catched this. That is a clue, that's it for now. All the followers of House MD would have already catched this one. Now let us move to our 11th question. A 32-year-old female on examination was found to have abnormally dilated left pupil which does not constrict in response to light. There are absent knee and ankle jerk and anhidrosis is present. On installation of 0.125% pilocarpine in the left eye, the pupil constricts. What type of pupil does the patient have?
In case of tie, we consider star question, guys. So be careful in answering this. And also there is negative marking for star questions.
So let us move forward then. Next, moving to our 12th question. A 34-year-old female complains of palpitations, weight loss despite increased appetite, heat intolerance since the past 6 months. On examination, there is tachycardia, tremor, lid lag, and the skin appears to be warm and fleshed. She is restless and anxious. What could have been the molecular basis to this sympathetic overactivity? Option A, increased concentration of circulating catecholamines. Option B, inhibition of muscarinic receptors. Option C, increased number of beta receptors. And option D, another biomolecule is stimulating the beta receptor directly. Please think and answer this question, guys. This question seems so obvious, but you have to think. Let us go move to our next question, 13th question. A 5-year-old child is brought to you by her mother who complains of breathlessness after playing for a short time. The child assumes a squatting posture as soon as she gets dismayed. Physical examination discloses cyanosis, clubbing, a normal S1 and a single S2 and an ejection systolic murmur. The electrocardiogram shows right axis deviation with right ventricular hypertrophy. The chest X-ray of the child is shown below. What is the child most likely be suffering from? see the characteristic shape of the heart in the X-ray? The answer is there only. Now let us move to our next question. A person infected with A developed high-grade fever, headache, and projectile vomiting. On examination, neck rigidity was present and Brudzinski sign was positive. Lumbar puncture showed gram-negative, predominantly intracellular diplococci. Another person who is infected with B developed fever, dysuria, and mucopurulent urethral discharge. Microscopy revealed gram-negative kidney-shaped diplococci. What is the simple biochemical test which can differentiate between A and B? Option A, DNA test. Option B, rapid carbohydrate utilization test. Option C, oxidase test. And option D, catalase test. Second years, this is your question. Please maintain silence. Now let us move to our 15th question, the third star question of today. A 10-year-old child is brought to the outpatient department by her father, who is an Ashkenazi Jew. The child presents with exercise-induced muscle cramps and weakness, which do not improve even after some time. The child also complains of nausea and vomiting after playing football at her school. On blood investigations, there was found to be hemolytic anemia, hyperuricemia, and hyperbilirubinemia. Muscle biopsy shows excessive glycogen accumulation. Which disease is the child suffering from, and what is the enzyme defect found in this disease? Please write both the answers. They carry half and half marks, like 1.5 for the disease and the enzyme defect carries 1.5 mark. If you answer both of them wrong, they'll be negative. One right, one wrong, 0. And one is answered, another is unanswered, 1.5, if it is correct.
I'm repeating again, guys. Star questions are tiebreaker questions. So please answer carefully.
How many of you want a clue for this? Question itself gives the clue. The glycogen accumulation and hemolytic anemia gives you the clue. That is itself the answer for the entire question. Now let us move to our 16th question. An 18-year-old individual presents with productive cough, dyspnea, and wheeze. He says these episodes happen 3 to 4 times a week. On examination, the mediastinum is central, vocal fremitus is reduced, hyperresonant note is noted on percussion, and polyphonic inspiratory and expiratory wheeze is present. Pulmonary function tests show reversible obstructive pattern. What's your diagnosis? Option A, chronic obstructive pulmonary disease. Option B, interstitial lung disease. Option C, bronchial asthma. And option D, pulmonary hypertension. Okay, shall we move to our next question then? Shall we move? Okay, now we'll be moving to our next question. 17th question. A 45-year-old male who is an industrial worker was brought to hospital with vomiting, headache, epigastric pain and blurring of vision. His colleague gives a history of intake of rectified spirit. What is the drug of choice to treat his condition? Option A, fomepizole. Option B, ethanol. Option C, disulfiram. And option D, pyribedyl. The question is drug of choice. So please be careful to answer this. So we'll move to our next question now. 18th question. A patient came with pain in abdomen. Further history reveals the presence of constipation and generalized pains. Serum analysis report is as follows. What do all these indicators point to? Option A, parathyroid adenoma. Option B, chronic liver disease. Option C, renal osteodystrophy. And option D, vitamin D deficiency. The parameters given are that of PTH, calcium, vitamin D, phosphate, and alkaline phosphatase. Want a clue for this? How many want a clue? Okay, I see so many hands raising. Okay, let us make it easy then. Just look at the phosphate levels. All your answer is in that. Shall we move on to our next question? So let us move to our next question, guys. 19th question. A 25-year-old primate in her second trimester was found to have 250 milligrams per deciliter plasma glucose concentration after 2 hours of 75 mg glucose intake. It was done as a routine screening procedure. She was never found to be diabetic prior to this. Which of the following risk isn't significantly increased? Option A, gross congenital anomalies. Option B, fetal macrosomia. Option C, polyhydramnios. And option D, preeclampsia. Among the options, which is the one you are least concerned about? Shall we move on to our next question? Now let us move to our 20th question. This is the 4-star question, guys. A 4-year-old male child with a 2-year history of focal onset seizures with impaired awareness is now being evaluated for gross developmental delay. There is a similar history of seizures and developmental delay in his maternal uncle. Examination reveals delayed speech and motor development, lack of eye contact and smile, and a continuous picking motion of the child's fingers. What is the child most likely suffering from? This is a star question. Shall we move on to our next question? Wait. Yeah, no. Now let us move on to our next question, 21st question. A 7-year-old child is brought to the orthopedic OP by his mother with complaints of change in the way the child is walking and running. The child complains of pain in the hip and groin region. On physical examination, there is tenderness, joint stiffness, and increased muscle tone around the right hip with limitation of abduction and internal rotation of the hip. The X-ray of the child is as shown below. What is the child most likely be suffering from? The X-ray itself gives you the diagnosis. Sir, are you participating? Shall we move on to next question? So now let us move on to our 22nd question. A 72-year-old man complains of sudden onset of headache, blurred vision, and severe throbbing pain over his left temple region. He also has experienced flu-like symptoms and joint stiffness over the last week. He previously had been in good health. The physical examination reveals tenderness and induration of the left temporal region. What is the individual most likely be suffering from? Shall we move on to our next question? 23rd question. A 40-year-old female who is a known diabetic is on oral hypoglycemics. She comes to the OP with complaints of burning micturition, increased urge to urinate, and presence of blood in urine. Which class of oral hypoglycemic drugs is she most likely using? Her blood glucose levels are normal here for clarification. But she is having burning micturition and all other symptoms. Here we need the specific answer, the class of the drug which is used. Please consider all the points which are present in the question, that is the clue. Now let us move to our 24th question. A 50-year-old male who has been smoking 2 packs of cigarettes per day for the last 20 years came with complaints of dyspnea and non-productive cough since 3 weeks with occasional hemoptysis. On physical examination, he has central adiposity and abdominal striae. His blood pressure is 160 by 90 mmHg. Chest X-ray shows a 6 centimeters mass involving the right lung near the hilum. Biopsy reveals clusters of cells with scant cytoplasm, ill-defined borders, fine granular nuclear chromatin, and absent nucleoli. What is a man most likely be suffering from? We want here the most specific answer. Describe the mass. What is that mass? Shall we change? So this is the last question of today, guys, the last star question. A 20-year-old male is scheduled for septoplasty. His history revealed the presence of excessive bleeding during a tooth extraction for an impacted tooth 5 years ago. Investigations revealed his hemoglobin to be 14 gram per cent, peripheral smear to be normal, platelet count to be 2.5 lakh, LFTs are normal, INR to be 1, and partial thromboplastin time is 45 seconds. Which is the most common antibiotic assay performed to confirm the likely diagnosis? We want the name of the antibiotic assay which is performed here. And after this, we'll have a run through of all the questions from back to forth, and each question will be kept for a maximum of 10 seconds, guys. And you need to check your order, the option, and the complete answer should be written for every question. So shall we all wind up? Shall we go through all the questions again? The questions will be going from back from 25 to first question. Okay, back to front. Okay. So every question will be kept for a maximum of 10 seconds. So the 25th question is here. This will be for an extra 10 seconds and then we'll go. And everyone mention your contact number, any one team member's contact number over your sheet, all the 3 team members' names. Don't forget to mention that, because if any of the finalists are present, it's very difficult to contact you if you don't write your contact number. So shall we start the run through again? Are you ready? Okay, then we are going back to the 24th question right now. Please check your order of the answers. Next is the 23rd question. Oral hypoglycemic drugs, class. Twenty-second question. 21st question. Please see the X-ray here, that's your diagnosis. Twentieth question. This is a star question, guys. And here, please give us the most specific diagnosis. Don't write the generalized diagnosis here. Most specific. If you write a generalized, it won't be considered. 19th question. Eighteenth question. All the parameters are given. 17th question. Sixteenth question. 15th question. This is a star question. Fourteenth question. Please check your order and write the complete answer. Thirteenth question. See the X-ray here and that's your diagnosis. Twelfth question. Eleventh question. Next, the 10th question, star question. Ninth question. Eighth question. Seventh question. Sixth question. Fifth question. Star question. Fourth question. Third question. Second question. First question. And guys, for this, don't mention the disease name. We want the name of the breathing pattern which is mentioned here, not the disease. Note that. Not the disease name, but the specific name of the breathing pattern which is seen here. So the time is up. All the volunteers, please collect the answer sheets.